Hello friends, welcome back to our channel VS Pharma Beginner. Today in this video we will discuss about diabetes, which is the top third leading disease across the world. In this video we briefly discuss about causes of diabetes, types of diabetes, diagnosis of diabetes and treatment of diabetes. Causes of diabetes include high blood pressure, impaired glucose tolerance in blood, overweight, nothing but obesity, physical inactivity, abnormal blood lipid levels in cholesterol, body mass index about 23 kg, and family history of a person generally causes diabetes. Types of diabetes. There are three types of diabetes: type 1, type 2 and gestational diabetes. Coming into type 1 diabetes, in this diabetes insulin cannot make beta cells was destroyed due to autoimmune disease. It is also known as insulin dependent diabetes mellitus IDDM. Coming into type 2 diabetes, it makes insulin but our body does not respond. It is also known as non-insulin dependent diabetes mellitus NIDDM. Now, gestational diabetes. Gestational diabetes occurs during pregnancy. Symptoms of diabetes include polyphasia, glucosuria, polyuria, polydipsia. Polyphasia means excessive hungry, glucosuria, glucose in urine, polyuria, excessive urination, polydipsia, excessive thirst. Risk factors of diabetes include excessive sweating, obesity, lack of exercise, hypertension, and genetics. Complications of diabetes include sweating, tachycardia, anxiety, increased force of contraction, ketoacidosis, etc. Glucose is stored in the form of glycogen. Again, glycogen converted into glucose when our body is in fasting condition with the help of glucagon, which is a hormone. Insulin is secreted from beta cells, whereas glucagon from alpha cells of pancreas. Diagnosis. The pre-diabetic range of fasting blood glucose is 100 to 125 mg per deciliter, and the diabetic range is greater than 126 mg. Oral glucose tolerance test. In this test, glucose is consumed. After that, blood is taken for sampling. For pre-diabetic condition, the fasting blood glucose is 80 mg per deciliter, and post-diabetic 140 to 199 mg per deciliter. HB1AC test. In this test, glucose is given into hemoglobin and measures the blood sugar levels. It measures past 2 to 3 months. The levels of pre-diabetic range of this test is 5.7 to 6.4 percentage. The level of diabetic range is greater than 6.5%. Medication. For treatment of diabetes, doctors prefer insulin injection and anti-diabetic drugs like sulfonylureas, dipeptidyl peptidase inhibitors, glinides, biguanides, glitazones, sodium glucose co-transporters, alpha glucosidase inhibitors. Thank you. If you like our content, please like, share and subscribe to my channel VS Pharma Beginner for more updates.